Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Learn about blood disorders. Blood disorders involve problems in your blood or bone marrow, the fatty area inside your bones that produces new red blood cells, white blood cells, and platelets. They are sometimes called blood dyscrasias. /r/n/r/n in general, when physicians refer to something as a blood disorder, they are implying that the condition is not cancerous, i.e., leukemia or lymphoma. Blood disorders include anemia, thrombocytopenia, sickle cell disease, von Willebrands disease, hemophilia, and others. /r/n/r/n This article will explore the types, causes, symptoms, diagnosis, and treatment of blood disorders. /r/n/r/n Images Medic Image/r/n/r/n When something goes wrong with any of these cell types or with the clotting factors in the plasma, the liquid part of the blood, you may be diagnosed with a blood disorder. The most common types are anemia, bleeding disorders such as hemophilia, and blood clots. Blood disorders are defined by changes in any of the parts of your blood. /r/n/r/n The following are common blood disorders. /r/n/r/n Some blood disorders live in a space between benign and malignant, cancerous sometimes referred to as premalignant, and may evolve into cancer. Leukemia is generally not included in the broader term of blood disorders as it is a cancer of the blood/bone marrow. /r/n/r/n Blood disorders can be inherited or acquired. /r/n/r/n Inherited blood disorders are those that are genetically passed down from parents. They include /r/n/r/n Acquired blood disorders result from environmental factors or other health conditions. Sometimes, they develop due to /r/n/r/n Symptoms of blood disorders vary widely depending on which blood component is affected. Some blood disorders cause few symptoms, while others are responsible for more. /r/n/r/n For example, /r/n/r/n blood disorders are predominantly seen by hematologistsphysicians who specialize in diagnosing and treating problems in your blood and/or bone marrow. /r/n/r/n Your physician will examine you and your symptoms to determine the most likely diagnosis. Most of the time, blood work is needed. Sometimes, blood disorders are found in lab work drawn for other reasons, such as an annual physical exam. /r/n/r/n The most commonly used test to diagnose blood disorders is the complete blood count, CBC. The CBC looks at the three types of blood cells and determines if any are increased or decreased or if more than one blood cell is affected. A blood smear may also be included with the CBC, with a microscopic examination to provide additional helpful information. /r/n/r/n For bleeding or clotting problems, your physician will likely order coagulation blood tests, which include the prothrombin time, PT, and the partial thromboplastin time, PTT. If the PT or PTT is prolonged, indicating that you are more likely to be bleed than others, further evaluation is needed. Your physician may order levels of individual coagulation factors or assess the function of your platelets. /r/n/r/n Blood clots are a little different. To diagnose them, your physician must image the area in question. An ultrasound is used to assess for possible clots in the arms or legs. Computerized tomography, CT, or magnetic resonance imaging, MRI, scans are commonly used in the lungs or brain. /r/n/r/n A bone marrow biopsy may be needed in some cases to help make a diagnosis. This is usually done by aspirating marrow from the hip. /r/n/r/n Treatment is determined by your specific diagnosis. Some chronic blood disorders have no specific treatment but may require treatment during acute events. For example, /r/n/r/n It is important to discuss with your physician what the best treatment is for you and your diagnosis. /r/n/r/n blood disorders can be genetic or acquired, caused by disease or environmental factors like nutritional deficiencies or drug side effects. Symptoms vary depending on the underlying cause of the blood disorder, but they might include fatigue, shortness of breath, increased bruising, and joint swelling and pain. /r/n/r/n Getting the appropriate diagnosis is essential to finding the proper treatment. Various medications can help alleviate blood disorders and address any underlying health condition. If you're concerned you might have symptoms of a blood disorder, see a healthcare provider for assessment. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.